Hello, and welcome to the Canadian Massage Conference pre-conference broadcast series on Massage Therapy Radio. I'm Felicia Brown, and I'll be your host for this interview and series. This is one of several broadcasts with the presenters and experts who are appearing at the Canadian Massage Conference and brought to you by the One Concept Group, November 4th through 6th, 2011, in Burlington, Ontario. I'd like to take this opportunity to thank the 2011 Canadian Massage Conference sponsors, the Vitality Depot, Lackner McClellan Insurance, Massage Therapy Canada Magazine, Biotone, Massage Warehouse, the Registered Massage Therapists Association of Ontario, and Hand and Stone for making this year's event possible. Our special guest today is David Kent. David and I will be talking about his 3-hour class at the Canadian Massage Conference, Back Pain, Breaking the Cycle. But before we get started, let me tell you a little about David. David Kent is the president and founder of Kent Health Systems that teaches full-body dissection seminars to massage therapists and acupuncture physicians at the University of South Florida College of Medicine. He also teaches deep tissue medical massage and practice-building seminars and has developed a line of products including the Postural Analysis Grid Chart, trigger point charts, personalized essential office forms, muscle movement chart, and a series of DVD programs. David has a monthly column in Massage Today called Keeping It Simple that provides treatment and practice building tips. He is also a regular contributor for Massage Magazine and other leading trade journals on topics from dissection, postural analysis, and trigger points. David, welcome to the Canadian Massage Conference pre-conference broadcast series. It's great to talk with you again today and to hear more about your class, Back Pain, Breaking the Cycle.
Hey, thank you, Felicia. I'm excited to be here and be part of the Canadian Massage Conference in this pre-conference broadcast series. I hope all our listeners out there are going to be able to attend the conference. If not, please stop by my website, davidkent.com, and at least see what you're going to be missing if you don't come. And I hope that at least you'll download some of my articles and learn more about what we're going to talk about in this interview today.
Well, I'm sure that people will do that, and we'll be sure to share that contact information with everybody at the end of the interview. Before we get into the topic, David, I'd like to ask you, what are you most looking forward to at the Canadian Massage Conference?
Well, the biggest thing I'm looking forward to is just hanging out and just getting to meet and reconnect with other therapists out there. You know, it's really refreshing to just get somewhere where you're with your peers, everyone's on the same wavelength, and we're all trying to do good, and it's a nice place to recharge. So I'd say if you're asking me what I'm most looking forward to, that's it.
I'm with you. It's definitely a great place to have fun while learning a lot and meeting new and old friends alike. I know there are lots of reasons that I have for suggesting this conference to people, but why would you recommend registered massage therapists attend the Canadian Massage Conference?
There again, it's about information, it's about contacts. You know, I meet so many people, I learn so much from my peers. It's a well-rounded group of presenters that are being there. You're able to connect in such unique and dynamic settings. You know, if you've never been to this conference or know anything about it, it's just rock solid. You know, everyone who's there, who's organizing it, it's a phenomenal team. They're therapists who organize it. They understand what therapists need. They bring in the best, well-rounded group, a variety of presenters that they're able to do. And the exhibit hall is, if you haven't been to the exhibit hall, it's amazing. You get to talk directly with the manufacturers, the suppliers, sample products. I know I'm giving away a set of trigger point charts with the raffles, and then also there's lots of fun. Club 54, we always do that one time during the conference, and you guys set it up great where you shuttle everybody up and back. You couldn't make it easier. So I hope everyone can attend because it's going to be fun and it's going to be an informative conference.
definitely right on both marks. The classes I went to last year were just simply phenomenal, including yours. I believe the class I poked my head in on yours was just absolutely packed. You're a very popular presenter, and this year will be no exception. Now, you're teaching 2 classes at this year's conference, one on headaches and one on back pain. Today we're talking about your class on back pain, breaking the cycle. I'm curious what your background or personal experience is with back pain.
Well, it's different. My other class, headaches, I suffered with headaches for a long time before I got into massage and when I first got into massage, and that helped me a lot. Back pain, the first two common things I treat in my clinic is neck pain and headaches. The third most common thing that I treat is back pain. And most of it was treating my clients for back pain, and then a few years ago, I actually, I've had some back pain on and off, but I finally really had that back pain where I had to cancel treatments, and then there I am, I always find it fascinating when I'm in pain. I kind of enjoy it a little bit because it just helps me connect with what my patients are going through, so, what was great for me was to finally myself have to apply. I already had it all down pat on what to tell people about headaches. Back pain was a whole new learning curve for me because I had to go through and now implement what I was always telling my patients to do when they were in crisis and see does it really work as well, So I think that when you have these experiences, it just helps you connect better with your patients. It helps you relate and then communicate better with them in the future, and it helps you seek treatment and learn more about your body.
Well, I think you're right, and one of the things that's made me a good therapist, I believe, is that I've had a lot of pain in my life too, and I've had to find what worked for me and what didn't work for me, and really see things from the client or patient side instead of, oh, this is a technique I learned in a class. Not that I'm suggesting people should go out and try to find a way to have back pain, but that's true. I don't want to wish it on anyone, but I think when you can bring your own experiences into the treatment room, not only does it help you to understand things better, but it in a way it gives you better credibility because your patients know that you have been there. They understand that you've had the same problem. I don't feel a bit shy about telling people that I've experienced the same thing or something similar to them because I think that makes them, confide in me more or trust me more or feel like I might know what I was talking about more than they would if I said, oh, yeah, I took a class on this. So.
Exactly.
Now, David, do you treat a lot of back pain at your clinic?
I actually do. I treat a pretty significant amount. Like I said, the third most common thing that I treat is back pain. For us here in the United States, at least where I practice, 80% of Americans are going to suffer back pain at some point in their life. That we definitely have a very significant overweight problem going on here in the States. And then, and that mainly hits people here in our country between the ages of 30 and 60 years of age, which is, in these tough times, especially a lot of people don't have insurance, so they're paying cash. So it's even that much more important that I'm communicating to them how massage can help. And then as a therapist, you can understand, boy, if they're carrying an extra 20, 30, 40, 50, 60 pounds, that is kind of working against us in treatment. But how can we get the client to understand, what we're doing and what the long-term goals are for getting them out of pain? So, I feel like on many different ways I do have some good experience with working with back pain, and I really enjoy it. I'm actually going to be showing you some slides of this one woman very twisted up, and to see how we were able to get her aligned in six treatments is pretty amazing. Doesn't happen with everyone, but still, just sometimes it's how we look at the body, how we communicate our findings to our patients, and then of course it's the patient's mindset and follow through. It's not all us, that's for sure. Their body's doing the healing. But a lot of it is how we educate to motivate, I would say. Some patients come in motivated, Some are only coming in because they're motivated to get out of pain, but if you can also help motivate them to care for themselves better, now we've got a whole different type of massage therapy fan out there running the streets.
Right. Well, now, David, this question is coming from me directly. I'm curious how when you just mentioned the weight issue, do you talk to your patients about weight being an issue in their back pain, or how do you broach that subject?
Well, when someone's coming in with me and again, it depends on what environment you're working and how you're going to broach it. With me, one of the things, a part of their intake form is they do initial that we're going to be looking at posture. They have signed a release for me to take digital imagery. Just like they do if they go to the doctor or the dentist, they signed a release that they can take x-rays or MRIs or whatever other test the doctor deems, necessary. Does that make sense?
Yes.
So that's why I've gone ahead and I've asked permission that we can take postural assessment, so that, to help determine our treatment plan. So when we look at the photos, and always before I show the people the photos, I tell them, listen, if everyone's posture was perfect, they wouldn't be here. They probably wouldn't even have any pain. And I zoom in and I move through, but basically I'm showing them where their bones are off in their body, because we're looking at bony landmarks, like are their shoulders level, their acromioclavicular joints. We might be looking at some points in their pelvis. We're looking to see if they have a forward head posture. And that starts to tell us where their back is going or the position of their pelvis. And so I'll show them those x-rays, and of course, or not x-rays, in their mind it's an x-ray. When I'm showing them a picture on my digital, on my iPhone, or you use your smartphone, or you can use your iPad, or you can use your computer hooked up, your computer monitor hooked to a camera, however you decide to do it, I keep it simple. I just shoot with my iPhone, I zoom in, I show them a skeletal chart or right on my posture chart where the alignment of the body should be and where they are. And then I show them utilizing a muscular chart and trigger point charts, which muscles are under stress. And I say to them, now you're in this catch-22. Here's the kicker. We need you to, I said, so part of these alignment issues are you're in pain, so now you can't exercise, so then you gain weight, and they're like, yeah, because instantly they're going to agree with you on that. Yeah, I'm in too much pain, I can't do. So I tell them we're going to have to, you'll tackle it however you can,
Right.
And you can give suggestions, say, I'm not trained, I'll give you whatever recommendations, because they'll ask you in treatment, what do you suggest? Then I start talking to them about water, I mean, it's, because really it's the simple basic things that if they can just do some of that, like they know people drink a lot of their calories by what they're consuming. If they just started drinking more water, they know in studies people will drop like 10 pounds pretty quickly and just by changing how much calories they're drinking, for example. So I try to talk to them about doing simple exercises like maybe walking if they can, but we can show them maybe ranges of motion that they can start to do. So your initial question was, how do I address weight? Weight comes up multiple different ways. They're typically mentioning it anyway at some point. And I let them know. I say, well, look, it's part of the game plan. That's what's important long term. And we start with the muscles right here. That's something they're going to work on outside of treatment. So we just make it sound like we're all on board. We don't avoid the white elephant. We just mention it once and move on.
That's a great answer, and that helps because I know I've personally had that in my practice where people say, well, my lower back's bothering me and I've gained some weight, and I think to myself, do I agree with them and say, yes, you have, or how do I broach that subject? But I think those are really spot-on suggestions and a very non-threatening way to approach it and to give them some ideas about how they can start the process in there while you're helping them get out of pain. So, part of that weight gain, it kind of relates to treating the cause versus the symptoms, but I'm sure there are other causes out there that are creating the back pain. How do you approach treating the cause instead of the symptoms?
See, it's all about education, and it is all about showing them all the different. We show them the symptom. The symptom is back pain, and then we show them all the causes. We show them posture, and we let them know posture is caused. Those bones are only where they are in space based on where the muscles are. We've got the same muscles on the right side that we have on the left. So if we're pulled to one side, something's too yin or too yang. You know what I'm saying? Some muscle, we don't have balance from one muscle. Of course, there could be some structural things going on with bones. I mean, that can be assessed and ruled out. But, for the most part, we're looking at what the muscles are doing with the body. And then, of course, those muscles, what are those muscles dealing with? They're dealing with gravity. They're dealing with the different weight of the body and even how that weight moves, the biomechanics of when they start to move that weight through space. And I'll show them in my class, like a video of someone, like as he's walking, you can just see him wobbling from right to left. Well, all the muscles in his back and in his neck are having to deal with that stress. There's a little bit of the movement to right and left as we're walking, but not this big wobble. So with getting the biomechanics of the body, and again, we can't just, it's not like we're going to turn some wrenches and bend some metal and everything's perfect. We've got to give the person some education. They've got habits that they've developed for a lifetime. 20, 30, 40, 50, 60, 70, 80. Sometimes I've had a client recently 93 years old, so you
Wow.
give them the knowledge and you give them the information, and then you see where it goes. I toss out a little bit in every treatment, and then I see, did they utilize any of it? Did they come back and ask me more? You know how that goes. Some people are into helping themselves, and some people just want to come lay there and they want you to fix them. I'll admit we can't help everyone, but we can do our best.
Absolutely. And I assume that you'll be covering some of the this education portion in your class at the Canadian Massage Conference?
Oh, yeah. I'm going to break down the education portion. I'm also going to break down and show you, if someone comes in with iliosacral pain, what are the 7 key muscles based on Travell's research that you should make sure that you double check. Or if they come in with lumbar pain, what are the 8 muscles that Dr. Travell would say to target? And even what order would she have said based on that research that you might want to check those muscles? There again, it depends how the patient came about those trigger points setting up in the muscles. And it's not all about trigger points, I'll grant you that, but it doesn't matter what type of body work you do trigger point therapy because you're going to run across these things,
Right.
Whether you're doing myofascial or structural work, and they're so common in the body that there again, doesn't matter what type of body work you're doing, the education applies to your patient. Structure, there's a map of the body. It's called the skeletal chart, and it shows exactly how it should all line up. And that's what the chiropractors do. They take an x-ray and they say, this doesn't line up. Here's the problem. Well, we can take a picture and show you what's not lined up. And then as we touch the muscles, it definitely confirms it all. So from a muscular point of view, I think a massage therapist in this day and age has some powerful tools and resources available to them now.
Oh, most definitely. You mentioned trigger points, but what are some of the causes of back pain that you'll be covering and learning to treat in your class?
Well, we're gonna make sure that we discuss posture. We're gonna talk some about gait. We're gonna talk about the muscular components. I will tap some on because we only have 3 hours, so we're going to discuss how nerves can be involved. And there again, we've all had those patients that come in where they can barely walk and they're kind of hardly able to crawl on the table, and you're thinking, why did you come to me today? You should be on ice, right? You're scared to even touch them, you know what I'm saying? Then you found out that maybe they've taken some pain medication and you're like, oh, now I got to be really careful because they can't give me good input. And during that whole process, and then they're telling you, oh, I've got this bulging disc, what are some good quick tests that you can do to rule it out? Or if you're doing insurance work, the majority of my business over the years has come from a few emergency rooms in the area. And so I see a lot of very acute stuff, and sometimes it's insurance work. And with that insurance work, sometimes people are not motivated to get well. So you've got to, checking some of those tests to see, are they being totally upfront with us, and, which ones are my favorites, and how do I utilize that? So just to determine who's a malingerer and who's really working on getting better. And then what is the self-care that you can provide for them? And that same self-care is what you need to be doing for yourself. So, I do share a lot of what I do for myself on a daily basis just to help maintain my practice so that I'm physically able to go in there and do the treatment, because it's hard being a therapist. It's hard work. I don't care what you do. It's tough work.
Well, it is definitely very physical and mentally challenging too. But it's really obvious, David, that you enjoy what you do. Is there anything in particular that you enjoy about treating people who have back pain?
I think the biggest thing that I enjoy about people who have, whether it's back pain or any type of pain, it's just going through the whole investigation process and asking, why is this, and why do they have this pain, and using this deductive reasoning to determine your next rational step, because the body is a very magical thing, but there are, it's like when you understand gravity, when you understand certain basic concepts and the laws of the universe or how the body works. I'm not saying I understand the body. I'm not trying to be anyone's guru here by any means. But, sometimes when over time, some time-proven fundamental things we know, and when we apply them, it can be very powerful. So I do love going through that process of assessing, educating, understanding my client. And this is something also that I'll tap on in class. Again, we only have 3 hours, but, is your client a visual, an auditory, or a kinesthetic learner? Like, for example, or when you're describing it to them, they go, I just don't hear what you're saying. They're telling you they're auditory. Or if they're saying, I just can't picture that in my mind, then I know I need to give them a visual explanation of what we're talking about. Like if they say, I just can't see that, I know I need to pull out an anatomical model and show it to them. I need to show them a visual on a trigger point chart. They're visual people. If they're talking to me and they're saying, now, I want you to hear me on this, or they're talking about they're using things, then I know that they're auditory learner and I need to talk to them auditory. Now everyone, we all are auditory, visual. People are more kinesthetic. Those are the people that when you say, where does your back hurt? And they go, well, I'm going to point on you. They're
right.
or they always want to touch you, or they're touching themselves. Okay, they're kind of, like I had a woman the other day, very just the way, so I knew, okay, I'm going to touch, I'm going to, it's kinesthetic with her. It's first and then we take those and you can actually layer them, realize, they're strongest kinesthetically, and secondly, they're visual, and auditory, they're weakest. So, sometimes if you can get that clear, it is even, but there again, it's just experience, and it's understanding, and it's enjoying the process, and it's just a process of learning. Like today, you give a massage that's much better than the one you first initially gave, so we get better all the time. But part of it is the passion, and just, I just love helping people. I really do enjoy it.
Well, it definitely shows. I've witnessed that passion, especially in terms of educating people in our industry, and I'm really glad that you shared the idea that this is a process, and kind of laid it out that it's not just about the hands-on work, it's about the assessment. I look at it as like solving a puzzle. And people come to me with this riddle or this maze, this puzzle I have to figure out. And based on the clues that they give me from the pain or the symptoms that they're having and their posture and all of those things that you've mentioned, then I can help them to figure out and help myself to figure out where it's coming from and what my best action is in order to help them. And I sometimes run into therapists that don't get that part. So I think it's great that you mentioned that, and I know that you provide a lot of tools to help therapists with that, which we'll make sure to get your website information in just a minute. Before we do that, I want to ask you, is there any piece of advice that you have for people who are interested in learning to work with those who have back pain or in taking this or one of your other classes?
Well, there again, understanding the mechanics of the body, understanding the anatomy of the body, I think is number one. No matter what type of body work you're in, you need to understand what it is you're working on and how it works and how it connects and how it functions. And there again, that's a learning process that I myself that I'm always going through. So anything you can do to learn more about the body, its form, its anatomy, its function, its physiology, I think is critical. I think it's also part of that process is applying that knowledge to yourself. So it is important that you're taking good care of your body, that you're doing the things like when your back hurts, you need to go to the freezer and pull an ice pack out, or you need to just do the stretching that you tell a client, because then you'll start to see, God, that's not so easy for them to do that, Maybe, I see if they get in these positions, that's much easier. So I have to teach them what to do if they get into these crisis states and how to think and how to breathe. I mean, they need to learn how to stretch and how to, it depends, you got to stay within your scope of practice, but I think there again is understanding that it's more than just there again, we're not healing them. They're healing themselves. We are facilitators. I think even our manual therapy, the body is a stimulus response. You touch it with something hot, it pulls itself away. You cut it, it will stop the bleeding. Same thing. We manually go in and treat it and try to influence it. We get a ball rolling and we start it. And we need to get that ball rolling in all these other areas of their life. And to really do it effectively, we have to implement it in our own lives. So, sometimes I guess that's why we got into body work, was so we could help ourselves. That's what I see this being about the coolest profession, is if you really apply it all, it's like you really get to take care of yourself while you're teaching other people how to do it. It's just, to me, that's just the coolest profession going. So I'm very grateful to be part of it.
Me too. I agree with you 100% on everything you said, and I really want to encourage everyone listening to come to David's class at the Canadian Massage Conference. But for those who aren't able to, or they just want to learn more about you in the meantime and check out details on the tools we've talked about and your other programs, can you share your contact information or websites with us?
Yeah, I've got two addresses that get you to the same spot. So you can go to davidkent.com and you can go to kenthealth.com. And once you get to my website, make sure at some point you click on Contact Us and give us your contact information so we stay in touch with you. Also, make sure you click on articles. So, like I said, there's something like 30 or 50 articles now up there that you can download PDFs, take to your fellow students, utilize yourself as a therapist, or if you're a teacher, there's lots of resources there for you as well. Also, click in the Watch and Listen, where you can learn more little tips on how I educate my patients and how to build your practice. I mean, everything that's there it's there because, like I said, I'm just like you. I'm a therapist out there trying to make a living, make it happen. If I figure out what's working, hey, I write an article about it, and share it. Why not? I wish those resources were not available when I got out of massage. So, like, what's out there now with the internet and what you can do and what you can learn. So, if you can't, make sure you stop by CanadianMassageConference.com and you see what's going on. Stop by DavidKent.com and learn more and watch the little YouTube clips about my classes. Because if you're not sure if you're going to come, you're going to miss a great time. So please attend.
Well, and thank you, David, for that plug. I want to make sure everyone knows exactly how to become a part of the Canadian Massage Conference. Of course, the Canadian Massage Conference is Canada's largest exhibition of massage products, continuing education, and new business opportunities for therapists of all disciplines. This year's conference will feature over 50 exhibitors, continuing education classes of 1 hour, 3 hour, and 1 day workshops, including David's, Friday and Saturday night receptions, and a private dance party at Club 54's Retro Room, which is adjacent to the conference hotel and promises to be a great time. The registration cost for the conference is just $40. This includes admission to the trade halls and all 1 hour presentations, participation in raffles and giveaways of literally thousands of dollars in prizes, including the items David mentioned, between class coffee breaks and loaded goodie bags. Attendees will also have access to many special offers and promotions from the vendors and exhibitors, as well as the chance to have a fantastic time with friends and colleagues. Now, for students, the conference offers a free student day and Smart from the Start program on Sunday, which is sponsored by Massage Warehouse and the Registered Massage Therapists Association of Ontario. This day is dedicated to massage therapy students who are currently enrolled in school or who graduated in 2011 and includes a free gift bag for the first 250 students. Also on Sunday, the RMT Career Fair will be held from 1 to 3 p.m. and is free to all registrants, including students. Again, all of this is happening at the Conference Hotel, the Burlington Holiday Inn, and I definitely suggest you make plans to stay there if possible. Single or quad rates are just $121 a night, but space is limited, so make your reservations now. Also, Massage Therapy Canada is printing the Canadian Massage Conference event program inside their magazine. This will be given out at the conference and distributed throughout Canada to over 5,000 RMTs. So if you are a vendor or educator who's listening in today and you want to get some great exposure for your products or classes, contact Christine Livingstone at Massage Therapy Canada for details on being a part of the conference program. Now, if you're ready to register and attend the Canadian Massage Conference, November 4th through 6th in Burlington, Ontario, come out and meet David and the other amazing presenters at this year's event. There are now 2 ways to do so. First, you can register online and pick your courses instantly at the official conference website, www.canadianmassageconference.com. You can also register by phone. Your call is free, and I want you to get a pencil to write this number down. It is 877-387-9111. That's 877-387-9111. We also invite you to stay connected with us on Facebook at facebook.com/Canadian Massage Conference. Again, the 2011 Canadian Massage Conference is made possible by all of our wonderful sponsors. Thank you so much to the Vitality Depot, Lackner McClellan Insurance, Massage Therapy Canada, Biotone, Massage Warehouse, the Registered Massage Therapists Association of Ontario, and Hand and Stone. I hope after today's broadcast, everyone listening is ready to come to the Canadian Massage Conference and register for this 3-hour class with David Kent, Back Pain, Breaking the Cycle. David, thanks so much for taking the time to be with us today and for sharing your time and knowledge. I can't wait to see you in Canada, and I'm really looking forward to your class at the Canadian Massage Conference.
Felicia, thank you for having me on the program. I want to encourage everyone to register. I've already made my hotel reservations because I know that it fills up quick there. I also, students do not miss Student Day. I'm going to be involved in that also, and there again, the resources and the tools that they're going to provide are phenomenal. So again, my listeners, thank you for your time. Felicia, thank you for all your efforts and energy and expertise, and I look forward to seeing you very, very soon.
Likewise, David. And everybody, this is Felicia Brown. I would like to, on behalf of everyone from the Massage Therapy Conference of Canada, that is the Canadian Massage Conference, and Massage Therapy Radio, I want to thank you for tuning into this broadcast of the Canadian Massage Conference pre-conference broadcast series. please remember to tune in each Monday through the end of October for more interviews and to visit www.Massage Therapy Radio for replays of all the interviews in this series. We look forward to seeing you in Ontario in November and hope you will also consider joining us for the American Massage Conference, April 20th through 22nd, 2012 in San Diego, California. Thanks again for tuning in and have a fabulous day.